this is what I watched the town hall yesterday with the president, and he's basically guaranteeing a vaccine by the end of the year. My problem is having a vaccine and making the vaccine are very different. You just promised that it could be hundreds of millions, which would eliminate a lot of what I'm most worried about, which is there's a million and there's just a rush to see who gets it. Do you think that the president is being too exuberant and it would be better to step back and say, we sure hope we can get something soon?
Well, I think that's probably the better wording, Jim. I mean, listen, nobody can guarantee anything. We're here, as well as all of our partners and collaborators, doing everything we can to make sure that a vaccine and treatments are available as soon as possible. And whether you refer to the current administration's comments on warp speed or pandemic speed, I mean, we're all in this together to literally accelerate wherever we can the development and the clinical timeline. And it's true that the typical timeline would be, as Dr. Fauci and many other his colleagues have said, 12 to 18 months. The hope is that we can look at this creatively. We can look for ways to shorten that time frame and make a significant number of doses available to the public as soon as possible.
But, Bob, when you look at who has done things fast, Ebola 5 years, mumps that I found was the shortest 4 years. Isn't this 18 months? Is there any way we could be just completely wrong? And we're just, that it's just a 3-year thing and we shouldn't try. Even 3 years would be incredibly fast.
Yeah, so I think it's important, Jim, to differentiate the timeline from beginning to an FDA-approved vaccine versus from the beginning to a vaccine that could be made available to the public under some type of emergency use authorization or compassionate use protocol in a much faster time frame. So, for example, once you go through a phase 1 and you're into a phase 2 and you're preparing to do the readout of that data, can we be prepared to have tens, if not hundreds of millions of doses of vaccine available, which have been manufactured at risk during the phase 2, so that when that data is read and the FDA can get comfortable with the safety and efficacy of that data, those doses can be released to the public under some type of emergency use authorization. That's where the shortening of the timeline could happen.
Don't miss a second of Mad Money. Follow @Jim Kramer on Twitter. Have a question? Tweet Kramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.